A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr.Suja K, ma'am. We welcome you, ma'am. We welcome all the participants to the today's session. So we would like to welcome today's guest speaker as well as the participants to the 12th AIHSAYA Vignan Sammelan series, in which the Ayurveda, Yoga, Unani, Siddha, Homeopathy themes have been embedded to share the knowledge also. So we would like to thank our bottom of the heart till now for all the guest speakers for their extensive sharing of their knowledge. So moving on to today's session. Today we have our guest speaker, Dr. Suja K, ma'am. Topic title will be Role of Ayurveda in Pediatric Care. So coming on to the introduction regarding ma'am. Dr. Suja K, ma'am is an assistant professor from Department of Kaumarabhritya, Ashtamgam Ayurveda Chikitsalayam, Vavanoor. So we welcome you, ma'am. We welcome all the participants. The session is all yours, ma'am. Thank you.
Respected dignitaries, it is my I am very delighted for this opportunity, as Lavanya ma'am has invited me as guest speaker for the session, and all other members, committee members who are included in this All India Homeopathic Association. Thank you. So today we will be dealing with role of Ayurveda in pediatric care. So Ayurveda is an ancient science that deals with body, mind, and spiritual well-being. The motive of Ayurveda is Swastasya Swasthya Rakshanam and Adurasya Vikara Prashamanam. That is, to maintain the preventative aspect, that is, to maintain the healthy stage and also cure from the diseases. So for a healthy life, we should adapt certain methodologies, right? That is a perfect lifestyle, dinacharya, ridhucharya, all those should be performed to achieve a healthy status. So children are considered to be the pillars of adulthood. So different measures should be taken to promote the immunity status of the children to resist against the diseases. So, and Kaumarabhritya is one of the 8 branches of Ayurveda. So Acharya Vagbhada has considered Balaroga, which is placed in the second position. Kaya Bala Grahordwanga, Shalya Dhamshtra Jara Vrsha. So Acharya has highlighted Balaroga. Acharyas has placed in different position. In as per Kashyapacharya, he and provide a lifelong immunity and strength to the children. So what is the importance of Kaumarabhritya? Kaumarabhrityam Ashtanam Tantranam Adimuchyade. Ayurvedasya Mahado Devanam iva Havyapaha. Anena hi Samvardidam idare Chikitsandi. Here Acharya mentions about Devanam iva Havyapaha. As Agni Devada is considered to be the prior among all the Devadas. Similarly, Kaumarabhritya is considered as crucial role over the future life of the child. Only then only the other specialties can get incorporated. These are the fundamental principles. That is, children are born with kapha dominance. So childhood is considered to be kapha dominant. So where the rapid growth and tissue building of the child occurs. So you can consider the kapha which is having Brahmana, Purana and Gauravada in nature, which is considered to be the body building and which is responsible for the growth and development of the child. And even in different stages, it is having similarity with the protoplasm as per the modern science. When you consider Agni status, the Agni status of the child is Aniyada, that is not stable. That's why children are more prone for the disease manifestation. So it is the responsibility of the pediatrician to protect and nurture the Agni. So, regarding the Pajaka Pitta and Samana Vayu role. Pajaka Pitta and Samana Vayu is responsible for the proper digestion and assimilation of the food. So, when the Agni status is not proper, it is imbalanced. Some people will be having improper digestion. Some will be having Atyagni. Some will be having Tishnagni. Some will be having Mandagni. So, depending upon the Agni status, there will be some disease manifestation. So, regarding the Karshya concept and the Shosha concept, that is malnutrition disorders, which is mainly because of the Kapha Dushti. So, if the status of doshas, Agni, and Dadu, if there is any impairment among these three principles, it will lead to the manifestation of diseases. So, Dadu Poshana, basic element which helps in construction is called as dhatu. So the ahara which we consume will be converted to the ahara rasa, which is again with the help of Budagni and Dhatvagni, it is converted to rasa dhatu and Uttarattara dhatu based upon the Stula Bhaga and Sushma Bhaga. So the nutrition and differentiation of tissue is different at different stages of life in children. So in embryo, you can see the histotrophic stage, and in placenta, you can see the hemotrophic stage, and after birth, there will be enteral stage. So regarding the samskaras, samskara hui gunanda radhana muchyade. Samskara brings. What is samskaras? These samskaras are the righteous rituals which are followed in the childhood period from birth till the child dies. So there are Shodasha samskaras which has been mentioned by the acharyas. Among them, few of them I am highlighting over here. The Jata Karma Samskara. So the Jada Karma Samskara, here we are administering Swarna along with honey and ghee, that is gold mixed with honey and ghee, which is rubbed over the stone and it is given to the newborn just immediately after the birth. It is given for the nutritive value and because mother will not be having sufficient breast milk in the initial first 3 days. To overcome this nutrition deficiency, Acharyas used to give the Swarna and Madhugrida combination. And not only that, it will give immunity. So here we are developing an immunity. Namakarna Samskara, where the baby is named. It is just for the social recognition among the society. It is done on the 11th day. Why Acharya has 100th day? 11th day Acharya has specified because the children might be suffering from some infections during that stage because the umbilical cord might have fallen. So to analyze and diagnose the disease manifestation during that duration, Acharya has specifically mentioned that duration. Regarding the Annaprashna, Annaprashna is a samskara where the children is administered with rice products. So Acharyas are having difference of opinion. Acharya Kashyapa has mentioned it should be done on 10th month onwards. Other Acharyas have suggested for 6th month onwards, where there will be teeth eruption. The child require additional calorific values. Not only that is, along with breastfeeding, they require other nutritive and energy-rich foods. So that's why we are administering the rice items, providing proper nutrition. Next is Karna Vedana Samskara. This Karna Vedana Samskara is piercing of the ear. So Raksha Bhushana Nimitta, for the protection as well as Abhushanam, that is ornamental purpose. Acharya has mentioned Karna Vedana Samskara to be performed at the 8th month of age. These are the samskaras that begins from before birth, that is Garbhadana Samskara, Pumsavana Samskara, Simando Naina Samskara. That is preconceptional care. So our duty and responsibility starts from the preconceptional care onwards. Where Shukra Shonida Samyoge tu Galu Kukshigade Garbha Satnya Labade. So Shuddha Shukra and Shuddha Artava plays a key role for a manifestation of healthy progeny, where we should do very strict dietary followance. Dietary followances should be done so as to get a good progeny. During the childhood period, we can adapt Jadakarma Samskara, Namakarma Samskara, Nishkramana Samskara. Nishkramana Samskara, where the children are brought out of the home. And Annaprashna, Chudakarna Samskara, Karna Vedana Samskara. For the educational purpose, it has been mentioned Upanayana Samskara, Vedaramba Samskara, and Samavartana Samskara. And during the adult and old age group, Vivaha, Vanaprastha, Sannyasa, and after death it is Anteshti. So Ahara, moving on to the Ahara, nutritional foundations. So Stanya, which is the basic nutrition of the newborn. It is considered to be the ultimate immunity booster. It emphasizes that mother's diet to ensure pure milk. So exclusive breastfeeding is suggested till 6 months of age. This breast milk is considered as Amrita. Why? It nourishes the newborn. Prenanam, Jivanam, Lebo, Sneho, Dharanam. All those qualities are seen in breast milk. So ideal amount of fat, cholesterol, all the proteins are and carbs are rich in the breast milk. So when there is deficiency of breast milk, we suggest that is AIHSAYA. In such condition, we can adapt other milks such as chagapaya, and Acharyas has mentioned certain other medicated milk products. Weaning foods. Weaning foods means the child should be, after the 6 months of age, the child requires additional calorie other than the one which is which the child gets from the breast milk. So here we should introduce light and digestible form of food such as moong dal, green gram, rice gruel. You might have heard about the ragi, which is made into the porridge form, ragi. Even our multigrain banana powder, which is dried, banana which is dried and powdered and which is used as a porridge form. These can be given as the weaning foods. So in Ayurveda, the weaning foods has been started such as Phalaprashana, Annaprashana Samskara. Phalaprashana, where the introduction of fruits and fruit juices has been mentioned. Similarly, in Annaprashana, we give the semi-solid consistency foods like rice gruel. So a mindful eating is very, very important. And we should follow Ashtahara Vidya Vishesha Ayadanas. You should avoid heavy, cold, processed or stale foods. These are the dinacharyas that should be followed in children. Abhyanga. Abhyanga majarit nityam sa jarasramavadaha. So it will prevent the baby from getting jara, and it gives higher longevity. Drishti prasada, pushti, ayu. All these are the benefits of abhyanga. So it helps in the temperature regulation. That's why it is suggested in hypothermia condition where there will be loss of body temperature. To prevent the loss of body heat, we can go for abhyanga. And even for getting a proper deep sleep, and it increases the circulation and helps in weight gain in children and proper growth and development of the child. Next is Nidra. Nidra is considered to be a very important pivotal role in the newborn's growth and development. A child should get a proper sleep pattern, otherwise the child will suffer from certain set of psychological disorders and some other diseases. Even it will hamper the metabolism too. In some studies, it has been shown that it enhances the inflammation. If the child is not taking proper sleep, it leads to the inflammation in body. So Nidra can be, Nidra has been, as per modern, they have suggested certain set of duration for age-wise. As per age-wise, there is classification of hour-wise duration. And that is, depending upon the age, they have suggested for certain duration of sleep. For example, 4 to 12 months, 12 to 16 hours of sleep should be done. 1 to 2 years, 11 to 14 hours. Similarly, in adults, we know 7 or more hours at night is required. So as per the age, there are difference in duration of sleep. So a baby or any children should sleep at proper time and they should reduce the screen time. For infants, it is suggested 0 screen time. More than 2 years, they can give for maximum 1 hour. And even Vyayama. Vyayama is nothing but the physical activity. It should be performed every day as a practice for enhancing the immunity, growth and development, and proper nourishment of the body. So there are many benefits of Vyayama. It is not only that we should perform the exercises. We can do we can adapt other methods, like playing is also an exercise. Swimming is also an exercise. Next is Swarna Prashana. So most of you might be familiar about the Swarna Prashana. Swarna Prashana is a method of administering purified Swarna Basma along with Gridha and Madhu. The key benefits of Swarna Prashana is Medhavardhanam, Agnivardhanam, and Balavardhanam. It is Vigrisha. It should be, the baby should be made to sit in facing eastern side. And Vigrisha Daude Drishadi, Prangmugi Leghunambuna, Amadhya Madhusarpibhyam, Lehet Kanagam Shishu. So the baby should be administered with gold ash, that is Swarna Basma, along with Madhu and Grida. So it is having multiple facets of benefits. Meda Agni Balavardhanam and Ayushyam Mangalam Punyam Vrishyam Varnyam Grahabaham. It enhances the longevity, it promotes complexion, it enhances the fertility. There is Vrishya, Varnya, Grahapaham. It protects from Graharogas. So these Graharogas are a major part of Kaumarabhritya specific area, right? There is difference in opinion of Graha Roga and Graha Chikitsa. How we can do general examination of children? So most of you have visited the pediatric OPDs, how they examine the child. So newborn, they cannot express. So we have to assess by ourselves by examining the baby from head to toe. So normal body structure will lead to good health. So you should find what all are the features, any abnormal features are seen in the children. And what are the Acharya has mentioned in Lakshanadhyaya, the specific general features of different body parts in children, that is nails also, gulfa, all those which are auspicious and which are inauspicious for the child, to analyze the future life of the child. And we can adapt Trivida Parisha, Chadurvida Parisha, that is Darshana Sparshana Prashna, Aptobadesha, Anumana, Yukti. All these examination methods, Dashavida Parisha, should be adapted to analyze and diagnose the disease condition of the child. So there are certain common ailments which is seen in the children. You might have come across, most of the children are suffering recurrent respiratory tract infection. So this is because of the lower immunity which is seen in the children. In Ayurveda, Acharya Kashyapa has mentioned a separate chapter in which he has highlighted regarding the signs and symptoms of disease manifestation. That is Vedanadhyaya. So the disease has to be diagnosed even from the cry of the child. So these are some of the common ailments like cough, cold, in which you can give Tulasi Swarasa, it is Tulasi juice along with honey, which is a home remedy. Even Haridra along with milk can be given. And steam inhalation, so that the child will get mucus congestion, relief from the mucus congestion. And in case of Udarashula or colicky pain, application of hing, that is acetophyta, over the navel area has to be done. And even you can give this fennel water that will soothe the gut. And if the baby is having some gum problems, you should mixture of ghee and a pinch of rock salt should be mixed along with the pepper powder, and it should be applied over the teeth to reduce the pain and inflammation. So when you approach a child, you should have a holistic approach. That is, it should be treated both my body, mind, and emotional well-being of the child. Ayurvedic physician should adapt Daiva Vyabhasraya, Yukti Vyabhasraya, and Sattva Vajaya Chikitsa to treat the child and even adults. Thank you, madam. Ma'am?
Ma'am. Yes, ma'am. Thank you, ma'am. Thank you so much for the enlightening session. So, respected participants, if there are any questions, you can
Questions,
comment
ma'am?
in the comment box. That's right, ma'am. You can comment in the comment box. So, ma'am will be answering. Yeah. You can also ask the questions directly to ma'am by unmuting themselves. Yes. Ma'am, one of the participant is asking to comment on the Garbha Samskara process, ma'am. You could explain in a better way. Yes, ma'am. Ma'am, am I audible to you, ma'am?
Garbha Samskara actually we Putragama Ishtitnya, all those things will come under Garbha Samskara. Yes, ma'am. And even Paricharia also comes. Once the child is once the baby is conceived, they should undergo Garbhini Paricharia. They should adapt the Garbhini Paricharia, which has been mentioned by Acharyas as per Masana Masikya Garbhini Paricharia, so as to get a healthy progeny.
So, what will be done in uh, don't mind, ma'am? Like, could you explain in detail, ma'am, if you don't mind?
Detail, it comes under Prasudi Tantra, ma'am. Actually, preconceptional care, it comes under gynecological.
Acha. Like, it was like taking care from the detection of the
Conception.
pregnancy. You mean to say?
Yeah, right from the conception, they have to start.
Yes, ma'am.
Because
Yes, yes.
the DNA which is encoded in the mother will be transferred, inherited to the newborn, right? So if we are not following a proper lifestyle, that is dietary lifestyle, and even if we are taking proper medicines as per the Masani, it will help for a proper nourishment of the newborn, and baby will be healthy. So you can go through the article related to that. That is Garbhini Parijarya.
Garbhini Paricharya. Sure, ma'am. Sure, ma'am.
7th
Thank you
month,
so
they
much.
have said Sampritak Parnyadi Siddhak Grida.
Hmm.
Gridak Shira Prayoga. It is from first month onwards, they should practice and intake of Grida and Shira. That is milk and ghee. We say that in the initial 3 months, they should adapt only Madhura Rasa Pradhana Dravyas. Sweetish in taste.
Ma'am, the question over is, at what month should a conceiving woman should start Garbha Samskar, ma'am?
Garbha Samskara can be started from the first month itself. No?
Acha. Right after detection of the conceive, like those who have, like mainly it is meant to say in third month one can detect easily, like with the help of the kids and all like that. If I am not wrong, right, ma'am?
From third month, you will come to know, see the fetal pole and all, right? Heartbeat and all. So initially there will not be such things. So
Really?
that's why. But in Ayurveda, we say we can adapt from the first month onwards.
Acha. Okay, ma'am. Okay, 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 okay. Mhm. Sure, sure, ma'am. Any other questions from the participant? Could you comment on the which type of Ayush Ahar specially should be specially given for the mother and the child?
Ahar. Actually,
Ayush
for
Ahar.
Ayush Ahar.
Like type of like comment on the food, ma'am. Food we can give according to Ayurveda, ma'am.
Okay, okay.
Hmm.
As per Ayurveda, we can suggest, we say that for children, you should give only Madhura Rasa Pradhana, Madhura Kashaya Rasa Pradhana Dravyas. So even foods also, you have to include,
Hmm.
like you can give milk.
Hmm.
That is until 6 months, you should give only breast milk. After 6 months onwards, you can adapt other semi-solid foods. Among that, as I have already mentioned, this moong dal, soup, all those which will be giving protein rich and
Hmm.
carbohydrate food should be adapted. Mothers can from first month onwards, they should not take so much spicy food items.
Rightly said, ma'am.
This both mother and child should avoid maximum spicy items.
Ma'am,
Should be
my
Shadrasa
question is,
Pradhana Ahara. Balanced rasa. That should be all the rasa should be balanced in our diet plan. In Sadhya and all, we used to take, right? Like
yes, ma'am. Hmm.
initially payasam we take. So that is the order how you should consume. At the end, we have buttermilk. So similarly, in home,
Hmm.
you can adapt such
Yes, ma'am.
buttermilk. You can take chas and all at the end after having food and all. Even for
Yes, ma'am. Ma'am,
children also you can
hmm.
give so that it enhances the digestion.
Acha. Yes, ma'am. Ma'am, the thing over is there any food dietary like food dietary in which a breastfeeding mother should follow, like for the good breastfeeding, because there should be some mothers during the some mothers while during the lactation period they will get only some amount of the breastfeed milk, right, ma'am? So could
Right.
you comment on the food in which they can increase their breast milk if they take some certain amount of food also?
You can include lashuna, that is garlic. It
Oh,
enhances
okay.
even fennel seeds.
Okay, ma'am. Garlic and
Enhances
fennel seeds.
the breast milk production. And we say that
Mm-hmm.
Anya Vardhana Ganas are there in Ayurveda. So you can consume that by making some ganji.
Ganji made up of, ma'am?
That is Pada Mahaushadha, some Stanya Vardhana Gana Dravyas are available in Ayurveda. So you can adapt that.
Is there the type of powder is also available, ma'am? Like in the type of powder?
In the type of powder is this available, but it is not in formulation method. Only individual powder will be available. You have to mix it up and prepare.
Okay, okay, okay. And is there any golden rule? Just one more question, ma'am. Is there any?
It's not audible.
Yes, ma'am. Now it is audible, ma'am. Yes, ma'am.
Yes, ma'am.
Ma'am, is there any golden rule which you want to comment for every pregnant woman?
I prefer, like in the initial stages, you should not have Ushna Tishna Aharas, like which is very hot,
Oh.
spicy. All those foods should not be consumed during the first phase.
Mm.
Initial first 3 months, you should not take because it will lead to sometimes abortion and all. Chances are there.
Oh, okay, ma'am.
Better you take sweet items.
Mm-hmm.
Milk is good. Ghee is
Okay,
good.
ma'am.
And you can consume this coconut water.
Coconut water, which contain lots of minerals and vitamins also. Yes, ma'am.
Yes. It is a rich source of calcium, magnesium, all those electrolytes also
Uh,
will be balanced.
yes, ma'am. Ma'am, actually, one of the participants has asked that is there any type of like a mantra which they can chant for good vibes, ma'am? Like before and before, like before and after the pregnancy, or during the pregnancy also, before, during, and after the pregnancy for their easy delivery, for their easy growth of the child, any for the mental peace also. Is there any type of the mantra which has been given in Ayurveda system?
As such, there is no such mantra, but you can adapt to Vishnu Sahasranama and all. Whatever the
Oh,
Vedic literature mantras that you can
mm.
chant daily so that it will enhance the memory power also of the newborn. The chanting vibration will create that
Mm-hmm.
environment
So,
for
chant.
proper growth of the child also. You know, you might have heard about the music therapy and all. So as such,
Yes, ma'am.
there is no
I
direct
think some
mantra, but
frequencies also.
yeah, that frequency and vibration will
Mm.
help in the growth of the child.
Sure, ma'am. Sure. Thank you, ma'am. Thank you so much.
Welcome.
I hope the participants are also have cleared their questions. And so I hope the session will be useful for all the upcoming sessions also, which they could include in their other system of the practices also. Thank you, ma'am. Thank you so much. Thank you for all the participants for active participation. So by Monday, we'll be get back with one more session from sir. And one second. So participants are also saying thank you to you, ma'am, for your
Thank
enlightening session, and they are thanking you for from our side also. We are thanking you so much for this enlightening session. Looking forward for many more. Thank you, ma'am. Thank you so much.
Thank you, ma'am. Thanks
So
to everyone.
respected participants, thank you, ma'am. Thank you so much. And so respected participants, will be right back with one more session on Monday. So we'll be back soon. Thank you all. Thank you so much.